Out of this, 6,000 veterans die by suicide each year. Now, that equates to about 125,000 veteran suicide deaths since 2001. Preventing it has become a top priority of the Biden-Harris administration, and well as the VA. 5 News reporter Jose Carranza shows us new care available for veterans in crisis, which starts this week.
Veteran suicides has been around as long as there's been veterans.
Ben Dykes is the Washington County Director of Veteran Services.
I personally have lost too many friends. I've lost 7 friends because of suicide.
The Navy veteran emphasizes that the battle doesn't always end on the battlefield.
First World War, there was a term called shell shock, and it's gradually grown and metastasized into what we now call PTSD.
In recent years, veteran suicide rates have dropped, after peaking in 2018 with about 127 veteran suicide deaths a day.
The VA has recognized that. 2020 was the second consecutive year where there was an actual decrease in the percentage of suicides, so that's huge.
Nearly 9 million veterans were not registered with the VA, meaning many were missing out on the mental and medical health services provided. But that all changes Tuesday.
Veterans, whether they're enrolled in VA healthcare or not enrolled, they can seek care at any VA or non-VA healthcare facility if they're in a suicidal crisis, and the VA is going to reimburse that. Also offer 30 days of inpatient treatment and pay for up to 90 days of outpatient treatment.
Dykes also points out that veterans don't have to visit the Little Rock or Fayetteville VA after Trump signed the VA Choice Act.
If you lived outside of 30 miles from a VA facility, then the VA would pay for that health care there.
All to help veterans with the struggles that come with service.
You know, that never leave a man behind is a great motto on the battlefield. But when you're off the battlefield, never leave your family behind.
Covering news where you live, Jose Carranza, 5 News.
Jose, thanks. Now, there are a few steps that veterans can take ahead of Tuesday. Dykes says you can use a DD-214 to show that you are a veteran at any healthcare facility. You can fill one out at any VA or community-based outpatient clinic. You can also get that information online through the National Archives.